Course Introduction, Advanced Clinical Nursing Practicum. Welcome to Practicum. You are almost done with your curriculum. My name is Sayda Major. I am an acute care nurse practitioner with 12 years of NP experience. My clinical experience has been in hospitalist medicine, hepatology, hepatobiliary surgery, and transplant medicine. I have taught in the MSN program at the University of Texas at Arlington since 2010 in the acute care program and the accelerated online program. Nursing 5631, 5632 is the final course before you graduate. This course is designed to help facilitate your learning and to help you develop an advanced knowledge of clinical reasoning. This course is delivered 100% online. There is no on-campus requirements or synchronous online meeting requirements. The main focus of this course is to enhance your clinical experience and transition into practice. The topics covered in this course will help you as you transition into practice. It is a 13-week long and has 8 modules. More on this later. Required assignments include discussion board assignments, clinical collaborative practice agreements from home, online Barkley practice certification. This is an examination that will help you know your areas of strengths and weaknesses so that you know the areas you need to focus on for your national certification from home. 360 clinical hours, clinical journal entries from when you reach 180 hours and 300 hours, SOAP notes, clinical tally sheets, in-place logs, faculty evaluation of your clinical performance, and preceptor evaluation of your clinical performance. Many of you are familiar with the online course structure, but it can vary slightly from course to course, so I want to clarify the structure. This course runs over a total of 13 weeks and has 8 modules. The module starts on Monday and ends on Sunday. This is typical from previous courses. Modules 1, 2, and 3 are only 1 week long. Modules 4, 5, 6, 7, and 8 are 2 weeks long. The course calendar has the length of each module on it and should be used to keep track of your due dates. For items which are due in a module that span 2 weeks, the course modules will tell you which Saturday of the module the assignment is due. For example, it will say, first Saturday of the module, second Saturday of the module. Required textbooks. American Association of Critical Care Nurses, 2017, Scope and Standards of Practice for the Acute Care Nurse Practitioner, Practice. Please note that a free PDF file of this book may be downloaded from the American Association of Critical Care Nurses website, https://www.aacn.org. You should all have the textbooks from Nursing 5461, Nursing 5463, Nursing 5454, and Nursing 5355 for reference during your clinicals. Central Standard Time Zone. The University of Texas at Arlington is located in the Central Standard Time Zone. As such, all due dates and times are based on Central Standard Time Zones. All students, regardless of their physical locations, are required to adhere to the Central Standard Time Zone due dates and times. It is the student's responsibility to know in which time zone they are located, how it differs from Central Standard Time Zone, and to ensure that they follow the due dates and times accordingly. Late assignments or tests will not be accepted if the student encounters difficulties due to the time zone discrepancies. Course assignments discussion board. Due in Module 1, there's only one discussion board assignment. This assignment covers employment negotiation. It is pass or fail. The rubric is provided in the course. Please follow the rubric to complete the assignment. You must complete the entire assignment to receive a pass. Otherwise, you will be required to repeat the assignment. Course assignments, collaborative practice agreement. Due Module 2. In Module 2, you will have a lecture on collaborative practice agreements. At least half of the states in the U.S. require NP to have some form of collaborative practice agreements. The agreements posted in this course are specific to Texas. Texas residents should complete one of the 2 sample templates posted in the course. Out-of-state residents should provide a sample practice agreement for their state or provide documentation that their state does not require a collaborative practice agreement. This is pass-fail assignment. Essentially, you must complete the assignment and your faculty will give you feedback. This equates to a passing assignment. Course assignments. Berkeley Practice Certification Exam will be completed in Module 5. This is the practice exam only. A minimum score is not required to pass the course. This is merely an opportunity for you to practice for certification. At the completion of your exam, you will be given the opportunity to review your question and answers and see what you got correct. The test will be open for you to take on a specific date and time. The date and time will be consistent with the time frame that fits in Module 5 and will be announced to the class once it has been arranged. The test is taken online through Berkeley's website and the links are posted on Blackboard. You will be required to open an account with Berkeley to take the exam. Full instructions will be posted in Module 5. Course assignments. Clinical hours. Total of 360 hours to be completed for this course. A maximum of 25 non-clinical patient care hours can be counted towards the total of 360 hours. Examples of non-clinical hours include Berkeley Review Course, the CDs, clinical conferences, class lectures, recorded video times count. Clinical hours may only be completed during the semester. If the clinical hours are not completed during the semester, the students may be eligible to take an incomplete. Incompletes are only granted for extenuating circumstances and require documentation. In the event that an incomplete is granted, the student will not be allowed to complete clinical hours until the next academic semester. Incompletes are not granted for work or personal scheduling conflicts. Graduation will be delayed by 1 semester for any student who takes an incomplete. Course assignments, clinical journals. First submission is due in Module 4 and the second submission is due in Module 6. Describe a time in clinical when you participated in an intraprofessional approach to patient care. Describe the scenario, the persons involved, your role, and the outcomes of the team's effort. How did the collaboration feel? Describe a time in clinical when you faced a challenge in the diagnosis, evaluation, and/or management of a patient. How did you work through the problem and how did it feel? Describe a time when you provided care which was culturally, spiritually, ethically, age, gender, or sexual orientation sensitive. How did this impact the care you provided and how did the patient respond? How did it feel? A late journal entry submission may result in the students being removed from the clinical until the journal is submitted. Soap notes. All students in the Adult Gerontology Acute Care Nurse Practitioner program are expected to appropriately, thoroughly, and accurately document each patient encounter in the patient's medical record. All entries made in the patient's medical record should be reviewed and co-signed by the preceptor. As part of the evaluation process within the course, students are required to submit clinical documentation of care provided to patients in a clinical setting. Students are required to submit 3 documentation notes in each clinical practice course and advanced practicum. The notes should reflect the patient's care provided in the clinical setting and resemble the note placed on the chart. There is a standard of care associated with documentation which is common across clinical sites. However, the AGACNP faculty understands that documentation is highly dependent upon the preceptor's requirements and clinical location. The documentation note will be reviewed and feedback will be provided by the clinical faculty. The student will select a patient from their clinical setting in which they have actively engaged in 50% or greater of the patient's management. Each student is required to submit one H&P or consult note from their clinical rotation. Each student is required to submit one SOAP note, follow-up note from their clinical rotation. The additional documentation submission can consist of an H&P, consult note, SOAP note, follow-up note, or discharge note summary. One of the submitted notes will correspond to one of the patient's case presented to the clinical faculty in the final clinical evaluation. All submitted documents should be completed and contain pertinent elements as determined by the type of note being submitted. Evaluation of student documentation is key element on the final clinical evaluation. As such, these notes will serve as the means by which the faculty will make an assessment and assign a letter grade on the documentation portion of the final clinical evaluation. Documentation which consistently lacks sufficient data, is incomplete, missing pertinent elements, or fails to thoroughly outline the treatment plan is subject to point deductions on the final clinical evaluation tool and/or we will require submission of additional clinical documentation notes. Do not copy or remove official clinical hospital documentation or HIPAA-sensitive information from the clinical setting. The copying or removal of documentation from the clinical setting may be considered a HIPAA violation and may result in course failure. Students will therefore be required to recreate the note and submit it within Blackboard while in the clinical setting or recreate the note at a later time. Documentation will be submitted using SafeAssign. Falsification of documentations will be considered unprofessional conduct. Failure to submit documentation in a timely manner may result in the removal of the clinical setting until the documentation is submitted. Clinical tally sheets. The tally sheet is used to keep track of your hours and the number of patients you see in clinical. Do not use the same tally sheet or sheet for two different clinical sites or preceptors. Please make sure to keep tally sheets separated by your preceptor clinical site. You may use more than one tally sheet for each clinical site, but do not mix the tally sheets. At the end of your rotation, the tally sheet should be reviewed and signed by your preceptor and submitted for faculty review in place. Documentation in place. This is the system in which you will enter your clinical schedule, hours, and days. You will enter non-identifying information regarding your encounters. You should complete your daily entries no later than 7 days after the day you complete clinical. Do not enter any patient identifying information. Faculty will review and approve your logs on a weekly basis. Students may be required to redo entries which are not complete. The following information should be entered in place for each patient encounter: date of encounter, site and preceptor name, time spent with each patient. This includes the time spent during the patient with the preceptor. Course assignments, faculty evaluation of clinical performance. All students in the adult GERI acute care nurse practitioner programs are required to complete practice hours in the clinical setting. These hours are designed for students to integrate didactic learning, acquire new knowledge and skills, allow for opportunity to manage patients in diverse clinical settings, and collaborate with other professionals. All clinical experience will be verified and documented. Each student is required to complete a clinical evaluation demonstrating assessment skills and knowledge application. Prior to the clinical evaluation checkoff, the clinical faculty will touch base with each student at their midterm clinical practice hours. Midterm evaluations of clinical progress are used as needed to prepare the student for the final clinical evaluation. This visit are informal meetings and are not graded. They will be completed in CP1 and may be completed based on student progress CP2 and practicum. This meeting can take place via video conferencing or telephone. The clinical evaluation will occur at or around the completion of your clinical practice hours using video conferencing. The clinical faculty will designate a specific day or time for the clinical evaluation. For the evaluation, each student will be required to have video and audio access. An external HD webcam with a tripod is required to be used to complete the clinical evaluation. The student will need to select 2 to 3 patient cases from the designated clinical setting. The student should only choose cases they were actively engaged in the management of majority of the patient care. Please do not copy or remove official clinic, hospital documentation, or HIPAA sensitive information from the clinical setting. The copying or the removal of documentation from the clinical setting may be considered a HIPAA violation and may result in course failure. The student is required to have an individual present during the clinical evaluation to demonstrate physical examination based on the etiology for which the patient is being seen and managed. The proxy patient may be dismissed after the examination is completed. The student will present a patient case to the faculty. The presentation should include all pertinent data to illustrate the patient's condition and the appropriate treatment plan. Following the presentation of the patient and physical assessment, the student will be asked questions to indicate knowledge comprehension, safe and efficient patient care. Questions can vary from pathophysiology, medication-related, lab results, physical examination, assessment, and plan. Faculty are at liberty to modify, for example, change the diagnosis, alter lab results, etc. The patient scenario to further assess practice comprehension and competency. Regardless of the student's clinical practice rotation, the student is responsible for knowing all aspects of the patient condition and care. The final documentation note, H&P SOAP note consult, should correspond with one of the patients presented during the clinical evaluation. The clinical evaluation tool can be located in place. Grading of clinical performance. The student must achieve an 80% of the scored items as, quote, meets expectation in order to pass the course. If the student fails to attain an 80% on the evaluation at the prescribed level of the course, the instructor may assign additional activities and/or additional clinical hours prior to reevaluation. The student will have a one-time opportunity to be reevaluated. A second faculty member will be present during the clinical performance retake. If the student passes the clinical performance retake with a minimum of score of 80%, the maximum grade the student can receive for the examination. Clinical practice requirements. The requirements are the same as they were for Nursing 5354 and 5355. The specifics are in your syllabus. Please review them. I will only review a few more important items to remember. Students are required to work their preceptor's schedule. Preceptors may have additional and/or alternative scheduling requirements. Students are expected to attend clinical in a minimum of 3 sequential days at a time, with no more than 1 week off in between scheduled clinical days until all clinical hours are completed. Exceptions may be considered for extenuating circumstances. Any exception must be approved by the student's clinical faculty. This will require students to adjust their schedule accordingly. Students' clinical schedule must be approved by their clinical faculty prior to starting clinical. Students may not begin clinicals until after they have received their approval from their faculty. Any changes in the clinical schedule must be communicated to the clinical faculty as soon as the student makes the revision in their practice schedule. Clinical practice hours may occur in the facility where the student is employed, except as described below. However, it is recommended that one clinical rotation be at a different facility. Clinical practice hours are not allowed to occur in the unit where the student currently works. Clinical evaluations will be scheduled by the appropriate clinical faculty with the respective student. The faculty reserves the right to perform unannounced clinical site visits any time during which the student is scheduled to be in clinical. This pertains even to the online format. Documentation of care. The student is expected to appropriately, thoroughly, and accurately document each client encounter on the client's health or medical records. For example, SOAP notes, clinical summaries, H&P, discharge summaries, consultation notes, or procedure notes, unless the facility prohibits. All entries made by the student in the client's record must be reviewed by the preceptor. Documentation will be co-signed by the preceptor. Invasive procedures. All invasive procedures performed by the students require direct supervision by the preceptor. Direct supervision means the preceptor is physically present in the patient's room, scrubbed and ready to assist the student if necessary. Students may not complete any invasive procedure in the clinical setting if they have not successfully completed the skill in the Clinical Practice 2, Nursing 5355. Students may only do procedures for which the hospital has granted privileges to the APRN to perform, and only if the preceptor is privileged to perform the procedure. At the end of your clinical hours, you will need to make sure you have the following completed: preceptor evaluation of the student, student evaluation of the preceptor and site, submit your tally sheets, all in-place logs completed. Only assignments submitted through Blackboard will be reviewed and accepted for a grade, regardless of the reason. Assignments that are submitted through email will not be reviewed for feedback or graded. A fail will be assigned in this instance. If you need your clinical journal proofread, please use the Writing Center or contact the writing coach, Dr. Lori John. Her email is ljohn@uta.edu. Plagiarism. Plagiarism is prohibited. Anyone caught plagiarizing any assignment will receive a 0 for the assignment in question and will be reported to the Office of Student Conduct. Some students believe that it is okay to copy word for word from the reference as long as they use citation and list the reference. This is not true, nor is it okay. This is considered plagiarism and is a reportable offense. All assignments should be paraphrased from your reference. This means that you should read all of the references, take some notes, and base off your understanding of your reading, compose an answer to the assignment using your own words. not the words of the reference. Please read the librarian's presentation on plagiarism. You will find this is helpful with answering many of the related questions. The link of the presentation can be found in Module 1 on the to-do list. SafeAssign is a program which is used to help identify plagiarism. All assignments are subject to be submitted through SafeAssign at any time during the course. The quality and acute care worksheets will automatically be submitted for SafeAssign when you turn it in. Plagiarism may be determined by reviewing references as well and does not require the use of SafeAssign. Plagiarism is a serious offense and not to be taken lightly. Students may be expelled, suspended, and placed on probation or fail the course for engaging in academic dishonesty. Grades. Clinical Collaborative Practice Agreement is pass-fail. Clinical Tally Sheet, pass-fail. In-place clinical logs, pass-fail. Total clinical hours, 360 hours, pass-fail. Journal entry, 180 hours, pass-fail. Journal entry, 300 hours, pass-fail. Barkley Practice Test, credit. Preceptor evaluation, pass-fail. Faculty evaluation of clinical performance, 80 or above to pass, pass-fail. Student evaluation of preceptor and clinical site, credit. Final thoughts. Again, welcome to Practicum. You can do this. Reach deep and you will be successful. Educational quote. Intelligence plus character. That is the true goal of education. Dr. Martin Luther King.